To add to that, going to therapy or taking medication for anxiety. In my life, this has been a constant issue. My partners and father were reluctant or defensive about it. It is hard watching someone you love refuse to go to the doctor, at the very least annually, and have health issues. Story 1. I am not against regular checkups in theory. What I am against is being run around and having my time wasted. The insurance company dictates most things, and the doctor is barely my doctor. They are booked solid with 30-minute appointments all day long. If I see my primary care provider for anything, it initiates a series of further appointments and blood work that are not really needed. The minimum commitment is 3 further appointments and sometimes 5 or more. I have very good insurance, so cost is not a factor for me, but I know for some people we are talking about thousands of dollars. For example, I have type 2 diabetes and was put on metformin. I also take omeprazole for gastroesophageal reflux disease. When I have an appointment to refill these prescriptions, for the metformin, the doctor wants blood work and then a follow-up. For the omeprazole, he needs to refer me to the gastroenterologist because that is who has to refill that over-the-counter medication. So that is 5 appointments for refills. Who has time for that? Taking off work 5 times a year minimum? Even just a couple of hours is a lot for the vast majority of people. That is without any other problems, just refills. Next, they are constrained in treatment mostly by insurance. For example, I use testosterone. I know a lot about the subject. The number of reasons why I would not go to an endocrinologist for my treatment could fill a small book. Some of the main reasons are, insurance will use it against me in the future. Endocrinologists are notorious for poor protocols and judgment. If you do not understand half-lives and you are prescribing me this medication, what are we doing here? You are a robot regurgitating dated, poorly researched protocols. They have very little autonomy of care. Why are we paying so much for this? Here is another example. Hey doctor, I use testosterone and have been addicted to methamphetamine in the past. Can we check my heart function? The response, no, you are not old enough. Are you serious? Story 2. When women have a problem with doctors, it is because they are sexist or because medicine in general is misogynistic. When men have a problem with the medical system, men are seen as the problem. To add to that, going to therapy or taking medication for anxiety is involved. It is 2025, and the American Psychological Association is only now seriously considering that their approach to men needs to be different. They still pathologize in doing so. This is not surprising. Psychology and psychiatry have long done this. It took them until 1989 to stop treating homosexuality as a disease, and they historically respond to pushback on their practices by doubling down. Therefore, it is understandable that men have a problem with that. Story 3. Well, you call to make an appointment only to find out there is no availability for 6 months. Then you show up 20 minutes early, as they ask you to do, just to sit in the waiting room until 20 minutes after your appointment time. Next, you get to the exam room and wait another 20 minutes for the doctor to come in and talk to you for 5 minutes. Then you go to the phlebotomist and wait another 20 minutes to get your blood drawn. Did I mention that you have been fasting since the night before and it is now 1:30 p.m. and you have not eaten anything all day? A week later, the nurse calls you to tell you your cholesterol is a little high, but your good cholesterol is high too, so they do not recommend any medications, only diet and exercise. Forget everything about that entire process. As for anxiety, medications only manage the symptoms of anxiety, not the cause. I do not need to feel better about my anxiety. I need help with the problems causing my anxiety. Story 4. Because it is a pointless waste of time. Doctors dismiss anything we ask them about. I could not even guess at the number of times I've been told, just take some ibuprofen, or it is nothing to worry about, or get plenty of rest and drink lots of clear liquids. I do not need to waste my time going to the doctor just to be told to take some ibuprofen. I can figure that out myself. And getting plenty of rest is not going to happen unless the doctor can somehow magically make it so I do not have to go to work and still get paid for it. Since they are unwilling to write me any acceptable note to give to my workplace so that I can get unpaid time off, getting plenty of rest is not happening. I am not some little kid with zero experience with doctors and this kind of behavior. I am 54 and have been to the doctor many times, and it has never resulted in anything but the above. They simply are not going to do anything unless we are practically dying, so that is when I will go deal with them. Story 5. When you go to the doctor and they say you are sick, what do you want me to do about it? Or when you see a therapist and all they do is push their trauma on you and treat you like you do not matter, you stop going. I had kidney stones and was forced to suffer for 2 to 3 weeks before surgery. My wife had kidney stones, was admitted to the hospital, and had surgery within 24 hours. Her stone was 7 millimeters. Mine was 14 millimeters, and I had 6 more that were 10 millimeters or larger. Why am I forced to live in pain for weeks? I had coronavirus disease 2019, went to the doctor, and they would not do anything for me. My wife went and was given many medications. I had to spend $160, $80 for each visit. At the second visit, I had to tell the doctor what I wanted, and he then took 5 minutes to say, "I guess I can do that." Story 6. Because I find it to be a waste of time. I am a cancer survivor and have a heart condition. I have spent plenty of time in the past 5 years in and out of doctors' offices. My specialist appointments are usually good, as they are knowledgeable and relevant to my life most of the time. Going to see my primary care physician for checkups involves making an appointment 4 to 6 months in advance, hoping they do not change the date or time, arriving early, and still waiting an hour just to have a 15-minute appointment where he advises me to eat more vegetables and exercise more. If I have an actual issue, I will gladly go to urgent care or the hospital. However, I consider annual checkups to be a waste of time, especially at my young age. Story 7. It is frustrating. The doctor is there for 5 minutes and does not even look at the patient's chart. They do nothing and then charge you $500. If everything checks out, you are fine, but if there is a problem, you could face financial hardship even with insurance. Our medical system is a serious issue in America. Story 8.1. It is expensive. They are literally not going to do anything except tell me to ignore it for 6 months and come back if it gets worse or does not improve. This is what they said the last 3 times. They do not even perform blood tests or cancer screenings anymore, so what is the point? They ignored a cancerous growth on my mother's face for a decade before performing a biopsy. They also refused to give her an X-ray for her broken foot, saying she was not showing enough pain. As a result, her foot healed incorrectly and permanently. When they finally performed an X-ray years later, they realized what had happened. Modern medical staff do not know what to do if it is not an actively bleeding wound. They will dismiss you or label you as drug-seeking until you become critically ill. Then they will understand the problem only after it is fatal. Story 9. Assume United States here. They cost an arm and a leg, and we have huge deductibles. Finding one who actually becomes engaged in your unique situation is like finding a unicorn. Spending 10 minutes in the exam room and getting a new prescription does not feel like legitimate healthcare. That said, I have Medicare now. I found a good doctor, and I am having all my issues addressed, preventive and otherwise, because I can afford the luxury. Story 10. I did not have a doctor for ages. The only medical associate's place in my area was not taking new patients and was not even answering calls about openings. I also did not have money if I did find one. My job did not offer insurance either. There is the issue where you could spend a whole day going to a medical appointment between getting there and waiting, and have it just be nothing wrong or not a real problem in the sense that it is something that will happen. Then what am I paying for? The pleasure of their company? I have had teleservice counseling, 40 minutes, 6 appointments. That is what got covered. To me, the idea that you have to try 4 to 7 therapists before finding a fit, when I barely have money for regular appointments, feels like being told to throw cash out a window and then fend for myself. If I had to go to half a dozen dentists before finding the right one, and the bad ones could be disastrous, I would not go either. Story 11. Counterpoint. As a man who has been going to doctors since the age of 18, I was never taken seriously until my mid-20s. I went there for my lack of energy, anxiety, and chronic health issues, but no one took me seriously, especially my parents. Trust me, I tried everything in my power. Now that I am a bit more financially secure and older, I can essentially force my way through and actually get the doctor to take me seriously. Story 12. It's just another chore and a pain, but necessary. I'm 18 months overdue and 3 years overdue for my next colonoscopy. Story 13. I do not feel sick. I am not in pain. I have no growths. Everything is functioning normally. Why go see a doctor? Story 14. I am not against it at all, especially after the parents died. The issue for me has been offices not accepting new patients or having appointments 6 months out. It is just a hassle. Story 15. In my and my dad's experience, we get rushed through the appointment, and issues we bring up are not documented. They act as if we did not mention anything until it becomes too late for preventive measures. Story 16. I am working on breaking the stigma about going to the doctor. It is tough to explain a problem and have it taken only half seriously. Then, when you do find a specialist, they tell you the symptoms you have just happened and there is nothing you can do about it. It is especially annoying when they are late for their own appointments. You have to take time off work and pay for the visits. Story 17. For me, it is the fact that I have to take time off work to then spend a copayment to typically be told what I already know. Additionally, I had 11 consecutive doctors misdiagnose an issue over the course of 6 years, creating a chronic mistrust of doctors. Story 18. Because it does not help. If I want medical treatment or healthcare, I have to argue with and lie to doctors. Unless there is a knife sticking out of me or I am literally coughing up blood, a doctor is not going to do anything to help me. I am in the United Kingdom for reference. Story 19. I spent 30 years in the Navy, and annual checkups were not optional. I continued this practice after retiring. At 58, I learned I had prostate cancer, for which I was treated. If I had waited a few years until I developed symptoms, I would be dead now. Story 20. Most men I know go to the doctor when necessary, and almost always when they are seriously ill. I recognize there are people who avoid doctors no matter what, and it does vary by racial and ethnic background as well. Regarding the anxiety medication question, remember that these individuals have a mental illness, which might contribute to their reluctance to see a doctor or take their medication. My ex-wife once decided she did not need her medication, which led to her losing control and experiencing psychosis, even though she honestly believed she was fine. The same applies to therapy. To benefit from therapy, you must first acknowledge that you need it and believe that it is helpful. Story 21. I am a 43-year-old male who goes every year for a physical exam and blood work. I had high blood pressure, which is under control with medication. I do not have any anxiety or stress that would require therapy. I am healthy and pain-free. Story 22. In the United States, it can take a while to get an appointment. The appointment may or may not be expensive depending on your insurance. Assuming you have no genuine concerns, the doctor is likely to say some variation of, you should lose some weight, exercise more and drink, smoke, or take edibles less. If you are sexually active, the advice will be, wear a condom and do you want to get checked? That is just not worth it for a lot of men. Story 23. The therapy aspect is that the person gets paid to keep you there. If the therapist actually helped you solve your problems, then you would not come back and they would be out of a job. Story 24. 9 times out of 10, anything wrong with me can be self-treated with either an ice pack or vitamin C with plenty of water. If I go to a doctor, they will most likely tell me something I already know. So it is usually a waste of time and money. Story 25. Something might be wrong. Something wrong costs money. Costing money is a burden on the family, and taking time off is a burden on work. Men are taught not to be burdens. Therapy only works if you are 100% truthful. No one has that trust. Story 26. I do not have any health issues, and getting healthcare providers to do more than check basic vitals and charge me a copayment is difficult unless I have specific symptoms to report. It does not seem worthwhile since I do not expect them to find anything during a 5-minute visit. Story 27. It's ridiculously expensive. I'd rather try to fix myself than be stuck on medication my whole life. Doctors are not perfect. In fact, they are often wrong. The third leading cause of death in American adults is medical error. Therapy has much lower success rates with men than with women. Most of my health issues come from a physically demanding job that I cannot afford to quit. no matter what it is doing to me, so these problems cannot be addressed anyway. The last time I saw a doctor, I was right and had accurately figured out what was going on with me and what I needed to do. One doctor's advice could have caused brain damage or even killed me if I had followed it. The list of reasons continues. Story 28. Routine checkups are more likely to identify false positives, which then cause unnecessary tests or treatments that carry complication risks, than they are to identify real problems. They also take time away from a limited pool of professionals who could better allocate their time. That is why standards of practice have largely moved away from routine checkups towards symptom-focused visits. Even in a system with capacity, the cost of unnecessary appointments is an expense to taxpayers. This calculus changes as you age. You can have enlarged glands you do not feel or skin cancer in places you cannot see, but most of those exams can be done manually without harm, similar to women performing manual exams for lumps in their breasts. These exams do no harm and can detect things you cannot otherwise feel. Eventually, you need to have semi-routine checkups. General medical advice has caught up to the fact that unnecessary visits and tests add risk and cost to a system that can better allocate resources. As you age, routine tests become worth the cost versus the false positive rate because the true positive rate starts to increase. However, this varies by the type of test and other factors, so there is no simple rule such as get a yearly checkup at 52. Story 29. Because men usually go to work before doctors, come home after doctors, and can't lose a day's pay. They would rather spend time with family. Some jobs frown on taking time off, and there is retaliation for that. Taking days off for doctors usually results in lower raises. It's not just one day. One day for doctors, one for blood tests, one for x-rays, and one to come back and listen to results. And the cost of it, insurance, deductible, copay, lost wages, etc. These are just a few reasons. Story 30. I went to see a doctor once as an adult. I am currently 32 years old and was 26 at the time. I spent about 5 hours in the hospital with an intravenous drip because they could not figure out that I had acid reflux. 5 hours. No thanks. That did not stop them from sending the bill. I will go see a doctor if I am dying or accidentally cut something off. Story 31. My mom is like that. She brags so much about how she felt healthy and strong her whole life, but for the past 5 years, she has started to fall apart. Both her mental and physical health are a complete mess. And at 79, she looks like 99. All this happened because she never wanted to check herself. Story 32. I should. Last month, I visited the ear, nose, and throat specialist to check my throat. Despite having insurance, I ended up with a $1,000 bill, and the visit lasted less than 10 minutes. Story 33. For me, this is a complicated subject. Part of my problem stems from, at least here in the United States, the cost of preventive care and medications. There is a lot of financial anxiety that comes with visiting a doctor and affording medical care. Another part of my complicated feelings is trusting medical professionals. I would say that COVID-19 created a lot of distrust for me. Of course, the consequences of medications are not necessarily known at the moment they are being offered, which adds to the anxiety. You might be solving one issue and creating an unsolvable problem when you do not have long-standing knowledge of how effective the medical procedure or medication will be. To top that off, having lost the desire to stay here on this planet, the idea of prolonging your suffering just does not appeal as much as you might think. Story 34. I have had great doctors who genuinely do their best to take care of me, but I have had just as many, if not more, doctors whose advice begins and ends with, "You are a man, toughen up." Story 35. This is not me, but I have felt the inclination. Usually, it is because of not wanting to miss work, previous visits that were unhelpful in addressing existing issues, doctors not listening, the cost, the time spent, and the feeling that I could be doing something else that provides immediate dopamine. Yet, I do it anyway because I know better. There is also the fear of procedures being painful, but no one will admit that except me. I compare going to the doctor with insurance. It feels like a waste of money and time until it is not, and by then it is often too late to avoid irritation. Story 36. Why visit a doctor if you feel fine? Why take medication for anxiety when you can address it in many other ways? Story 37. I do annual doctor checkups, see a therapist, and weightlifting is my anti-anxiety medication. I also wash myself and brush my teeth. Who are these awful men I read so much about? Why are you spending so much time with men who do not know how to care for themselves? Story 38. Considering it is Men's Mental Health Awareness Month, I think the most likely cause is that men are taught to be tough, stress about small things, and to suck it up. That attitude does not just affect thoughts and feelings, it translates into the medical world as well. Men die on average 6 to 7 years earlier than women, often because they seek help too late, only when their condition becomes severe. Women, on the other hand, are generally encouraged to express their feelings. Because they often care for others, they understand the importance of caring for themselves at the first signs of problems. This awareness allows them to catch issues earlier, where interventions have a higher chance of success. It is truly sad what society has done to boys and men. Story 39. I dislike going to the doctor, but I have no problems in my yearly checkups. Perhaps most men follow the saying, if it is not broken, don't fix it. Story 40. Even when I was bleeding 8 times a day, unable to work, and lost 25 pounds, reaching 130 pounds at 6 feet 3 inches, the doctors did absolutely nothing. It took 4 months to see a specialist. In the meantime, I fixed it myself with the help of online research. I tried a strict elimination diet and discovered it was gluten. By the time I saw the specialist, I was still following the diet and feeling fine. They just shrugged and said to keep it up, I guess. You will have to forgive me for my lack of faith in our healthcare system. I will see them if I really have to, but other than that, I feel fine, so why bother? Story 41. I'm in the United States and it's just hard. I was going through some tough mental health problems for a bit in my early 20s. My father passed away and I was a mess in school. Finally, after some advice from girlfriends, I called a therapist. The receptionist said the earliest appointment was 6 months away. She asked if I was suicidal because that would speed things up. I just laughed and hung up. Then I developed a serious pain inside my bladder and penis. It was bad. When I was not urinating, it felt like a burning sensation. After numerous tests and consultations with various doctors, they always concluded I must be making it up and was depressed. I never took the antidepressants. After 5 urologists, I finally found a younger doctor who listened and treated me for prostatitis. It took almost 18 months of constant suffering. I'm in my 30s now and I still have side effects due to the incompetence of the healthcare industry. I have never had a good experience. My father-in-law almost died due to a burst appendix after complaining multiple times about a sore hip area. They said, it's just a sore muscle. Lay in bed for a few weeks. He almost died in his sleep. Luckily, my mother-in-law was there for him. Story 42. Therapy can be very expensive. I'm not spending $65 to $250 a session or $60 to $320 a month just for someone to confirm I have anxiety and depression, or to prescribe me medication. Many mental health issues can be helped by having a good supportive network of friends or family, in my opinion. Story 43. I am busy. I have an important job, people counting on me, a big salary, and a calendar booked for months. That is not a good excuse, but it is the actual reason. Story 44. I booked a physical with my primary care provider since I couldn't remember the last time I had one. He seemed confused and slightly annoyed that I was there with no specific concerns that I wanted addressed. He quickly looked at my eyes and ears with a light. That was all he checked. No stethoscope, no blood pressure, no skin check, no testicular exam. He said that was it and told me I could go. I asked about blood work and if I was up to date on all my vaccinations. He said they do not do blood work unless they are looking for something specific. He looked at my vaccination chart and found that I was due for one. He was not even going to look at it if I had not asked. He said I did not need to book another appointment unless I had something specific I wanted checked out. I was 30. Story 45. A lot of us have been trained to avoid doctors. It's just the way it is. You work through pain and illness whenever possible. I know many women who insist on working when they are too sick to be there. I used to think men were weak when it came to illness, but a friend of mine who transitioned experienced her first man cold. and was bedridden for nearly 2 weeks. So I think there is something to the theory that men get sicker because of higher testosterone. Most of us definitely don't enjoy missing work, letting people down, and risking our reputations. As far as therapy goes, there has been an idea online in recent years that no human problem can be solved without first paying a stranger to tell you things you already know. I'm sure therapy works for some, but given how many people are one missed paycheck away from total economic collapse, therapy is a luxury they cannot afford right now. Story 46. I go to biannual checkups because I have to buy my own insurance. Going to those checkups lowers my premiums. I have a friend who gets insurance through his employer. His wife does not work. He is in good shape but feels unwell all the time. He avoids figuring out what is wrong because if he goes to the doctor, he will have to take time off work. Time off work means no income, so no bills get paid. He believes it is better to just deal with it and die suddenly so his family receives a life insurance payout. Story 47. I finally got set up with a doctor so I can get regular checkups done, and I am really happy I did. I am 47 years old, so it is a little late, but better than not at all. I totally advocate for getting your regular checkups as you age, especially. Story 48. I went to therapy because I definitely needed it. I don't go for regular checkups because I mostly take care of my body. It is like, why go to the dentist to have him tell me my teeth are just fine when I already know it in advance based on my oral hygiene? Story 49. These are different things. I go to yearly physicals if only to keep my vaccinations current and get referrals for specific things I need. I am skeptical that the broad range of therapy options available are particularly helpful to a large number of men, but that is a discussion too large for this thread. My question to you: why are North American women so comfortable with taking so many selective serotonin reuptake inhibitors? Obviously, there are some cases where they may be needed in the short term, such as hormonal fluctuations during perimenopause. However, the number of women taking selective serotonin reuptake inhibitors is staggering and not fully explained by specific gendered hormonal issues. Story 50. I see a doctor 4 times a year. It has nothing to do with general checkups. It is just about pain management. Other than those visits, why would I go to the doctor only to hear that either everything is okay or something is wrong? Either way, my life continues as it goes. Any other bone than a rib or coccyx breaks, and I will see a doctor. Those two are the ones they cannot do much about. All the doctor would have said is that I should not snowboard until it is healed in 6 to 8 weeks. No thanks. Story 51. My health insurance actually covers an annual physical. Last time I had one, I asked the doctor how often I should have one. He said if there are no real changes, maybe every 2 or 3 years. Story 52. For me, it has always been a financial barrier. I did not have health insurance for a long time. I finally started going to therapy in 2018, although I have stopped again due to rising costs and insurance coverage getting worse every year. Story 53. Because my doctor said to come back in 5 years for a blood test. I am fit, exercise regularly, do not smoke, and rarely drink. I do not use drugs. The blood test was fine. He said there is nothing to see. If I do get sick or have an injury, I will come back. At least until I am over 45. Story 54. Different reasons for different people. I do not go because you can get billed for something that you do not have. I only go when I know that something is wrong with me. I know that certain cancers and diseases are not detectable until it is too late, but I would rather deal with that than be in debt for the rest of my life for something that I do not even have. Yes. Good luck trying to win a court battle. Story 55. After reading and interacting on this thread, I think the answer is twofold. Things are expensive and many of us are, frankly, not very smart. Story 56. Modern primary care doctor appointments are similar to using a search engine. For example, very few primary care offices perform annual in-office blood draws anymore. Instead, they recommend a diagnostic center in your area to complete the tests. Then, you must schedule a second appointment to meet with your primary care provider to discuss the results, which you can already access through the diagnostic center's portal. For specific ailments, your primary care provider will refer you to a specialist. However, you could find this information yourself by searching your insurance coverage portal. So, What do primary care providers actually do besides make referrals or provide printouts of diagnostic information you could find online? Story 57. Because annual checkups do not provide much benefit, why would I waste time and money on them to satisfy someone else's concerns about my health? Story 58. I generally feel fine and monitor important health metrics, such as blood pressure, on my own. If I don't feel well or become ill, it usually resolves within a few days. I have not felt the need to see a doctor. If something consistently felt wrong, I would consult a doctor. Since that has not happened, I continue as usual. Regarding therapy, I do not believe I need to attend. This is not about being tough or macho. Honestly, I am unsure what I would discuss with a therapist. I experience ups and downs, but that is a normal part of life and something I feel capable of managing. Story 59. I don't care about living as long as I possibly can. It's not bad, but it's definitely not spectacular either. Just eat right, exercise, practice gratitude, build relationships, and wait for your fate. If cancer or some other illness is about to take me out, then I will die, or you will have to pull the plug so this does not get drawn out for all parties involved. Story 60. Too expensive. Do not trust the medical industry. I do not necessarily want to know if something is wrong because it will most likely be too expensive or impossible to fix. Medications are pushed too much, and the side effects are often worse than the problem and expensive. Therapy is not the solution for some. Some of us have been harmed by therapists to begin with. Again, trust is an issue, and it is expensive. Story 61. I mean this politely, but after the third therapist who is completely unhelpful, you stop going. I am anxious because the world is difficult, not because of some deep-seated trauma. I cannot think my way out of the rising cost of everything or the destruction of our world for profit. Story 62. Why would I waste their and my time doing that? It is irresponsible and causes delays for people who actually need to see them. Story 63. Habit of being healthy when younger. Being healthy. Not buying into large pharmaceutical companies or therapy services. Not needing an expert to ease our anxiety. I work in physically demanding jobs, and there are many years when I do not see a doctor, other than for vaccinations. Is that the right balance? Probably not, but the medical system is also a crutch for people who make consistently poor health decisions. Story 64. 1. It is expensive even with insurance. 2. We would have to take time off from work, and even if we have paid time off, it reduces your paycheck unless you are a salaried employee. 3. If I ignore it, it is not there. Story 65. For me, I knew I had mental health problems in my early 20s. I tried getting help for years, only to be told repeatedly by different doctors that therapy is for women and girls only. If I start having suicidal thoughts, I am advised to make an appointment and come in. Appointments take about 2 months, and they would have me involuntarily held for a psychiatric evaluation. Decades passed, and only now do doctors and psychiatrists take what I am saying seriously. I tried calling childhood trauma call centers, but they were very hostile toward me for being a man. I stopped calling them. They do not take men's health seriously when we try. Story 66. Because that is not what doctors are for. That is like replacing your car's tires on a schedule instead of when needed. You are just wasting money and time. Story 67. I am confident that hesitation to go to the doctor is a worldwide issue, but consider the United States specifically. The poor privatized healthcare system actively punishes you for seeking any medical care with a hefty extortion. If you are familiar with Pavlov's dog, that is a constant punishment that teaches people it is not worth doing. Story 68. Cost versus rewards. I am not against checking a few things at reasonable intervals. I have bad teeth, so I do a yearly checkup with my dentist. I am in good health. I have medical visits for work every 5 years at most. I go to the doctor when I have an issue or need a certificate for sports, which is valid for 3 years. Why should I go more often when my area has a 2-week delay for people with actual health problems? I know my blood pressure, pulse, and weight, or if I have inflammation. I also keep up to date with vaccines. These are the things I would get from a basic checkup. Story 69. I'm not. I have never understood the mentality. In addition, the company I work for provides a significant credit applied to my premiums each month if I go every year and get blood work done. So it is a no-brainer for me. Story 70. Most men, especially older ones, still believe it is a sign of weakness to show that they are suffering from any illness, even minor. We grew up being told to suck it up, princess. The cement truck is outside, the driver has a spoon for you, and other toughen-up style sayings. So we do what is expected, we put it aside and carry on. Not only that, workplaces essentially make us, and women too, feel like absolute scum for taking time off because we are sick. Story 71. I have heard many women share stories about how doctors do not take their issues, especially pain, seriously. They often hesitate to provide medication or run tests and dismiss concerns as insignificant. I have experienced the same problems, so I only visit a doctor when I have a concrete problem with a known solution, such as high blood pressure. It is accurate to say that women are generally treated worse than men by doctors. For example, only recently have doctors begun recommending pain management while inserting intrauterine devices into women. Despite men receiving comparatively better treatment, I have little faith that any doctor I see will truly try to help me. Even when they do, the medication prescribed often does not work effectively. I typically use telemedicine once every 6 months to a year to get refills for my migraine injections and blood pressure medication. If I broke a bone or had a serious issue, I would go to a doctor, but otherwise I do not see the point. A better question may be why so many women remain determined to seek medical care when it seems they are helped less and treated worse than men. Story 72. Waste of time and money. I will go when there is something wrong, or at least when I am old enough that there is a reasonable chance they will find something. Story 73. I've had men in my life like this, including my significant other. The solution has been pretty easy, although not successful for everyone. Just book the appointment for them, put it on their calendar and leave a sticky note. Don't even have a big discussion. Just book it. Chances are they will be too lazy to even cancel it and will just go. Story 74. I go to the doctor with an issue, and they always seem to just give general advice. Exercise more, eat better, and so on. It often feels like the doctors do not really care. Some female doctors have come across as quite dismissive. That said, I do try to keep on top of things these days. Story 75. Honestly, for most of my 20s, I had chronic back pain that I knew I could not afford to treat, and I did not want to deal with the conversations that would surround that. Turns out it was not as bad to treat as I thought, but at the time, it still would have been more than I could realistically afford. Story 76. My spine is collapsing, but my doctor just wants to do more spinal injections that either do nothing or make it worse for a while. I have rejected the idea of starting to take narcotics because once you start taking them regularly, it is hard to stop. So I take ibuprofen and deal with it. Story 77. This thread makes me very grateful we have free healthcare. Before any of you Americans criticize me, my national insurance costs are much lower than your premiums. Story 78. I go to the doctor consistently. I used to have a service called Forward that made it amazing, but they went out of business. I don't do therapy because the only people who tell me to get it don't want to accept that I have feelings. I don't let people like that tell me what to do. Story 79. Because nobody helps men. Nobody ever helps me. Every time I reach out for help, I end up having to do it all by myself or abandon the idea. Story 80. Usually, the doctor gives you pills and tells you to wait. I can wait at home, and pills usually do not help. Either perform surgery and fix me now, or send me to a physical therapist who can provide treatment. Doctors usually do not take action unless it involves prescribing medication. Story 81. Most men do not want to be a bother because every day their families and partners make them feel like a bother just for existing. Most of us want to leave behind enough so that those left will not curse us for dying penniless. Story 82. You don't know most men, just as I don't know most women. The premise is already annoying. Your subjective experience doesn't imply the majority. I can tell you why I don't go to therapy and neither do my male friends. That's because we already have people in our lives with whom we can be our true selves for free. The concept of paying someone to talk about myself is incredibly strange. In a situation where someone doesn't have anyone to talk to, I can understand paying someone. You can take a step deeper, and perhaps there are others who don't want to face trauma with a professional. Coping and dealing with life as it is feels safer. I can't relate to yearly checkups because I don't mind those. I don't necessarily go to a doctor consistently, though. Most of the time, when I feel sick, it's a common cold and doesn't require me to sit in a waiting room. In most of my relationships, the girlfriend was constantly at the doctor's office for anything, ready to take whatever pill because the doctor said so. Medication for anxiety is also something that makes no sense to me. I'm an adult and I know what situations make me anxious. It's my responsibility to manage and navigate them on my own. I'm not going to take pills to soothe an aspect of myself. Large crowds make me incredibly anxious. Do you think I go to concerts or other gatherings? No. Narrow streets with lots of people walking around and many distractions also make me anxious. Do you think I drive downtown often? No. You can continue that pattern throughout everything I am aware of. Sometimes with an ex, I was baffled by the comfort in taking pills instead of trying to build coping skills naturally. The "I forgot to take my medication" excuse for some things blows my mind. You're an adult. There are, of course, legitimate disorders and conditions that warrant medical attention, but everyone gets anxious at different levels. Should everyone take anxiety medication? Story 83, Judgment. When a woman goes to a doctor and something is wrong, it is because something happened to her. When a man goes to a doctor and something is wrong, it is because he did something wrong to deserve it. I had a health complication because I was born without a blood vessel between an artery and a lung. This condition was not diagnosed until I was in the hospital with the complication. I did not receive any sympathy from anyone. Instead, I received suggestions on what I should do after my month-and-a-half-long stay in the hospital. Story 84. I feel like that might just be a thing for older men, at least older than me. I do not know any men college-aged like me who are like that. Story 85. I am in Canada and I get checked annually, even more frequently because colorectal cancers run heavily in my family. In the United States, it is probably a cost issue. Story 86. I do not need to see a doctor for a checkup. I know what they would tell me. Otherwise fine, but could you exercise more, improve your diet, and drink less? To that, I would answer, no. Therapy is for women. I do not have anxiety at a level that requires medication. Story 87. This is a great question. I actually do not know people who are like that. Most of the men I know and am good friends with get their annual physical examinations because it is the right thing to do. I have not really come across people who are apprehensive about going and getting a physical examination. Story 88. I stopped going around age 18 and did not go again until my 30s. I think the main reason is that, as a child, those doctor appointments felt humiliating and degrading, making me sit around in my underwear, talking to my mother about me while I was sitting right there, and shoving a wooden tongue depressor down my throat until I gagged. The nurse would tell me in a cheerful voice to urinate in a cup. I could go on. I do wonder if many other grown men had similar experiences as children. I was honestly surprised when I decided to go again how respectful and non-invasive it is now. To anyone hesitant for any reason, just go. You may prevent some issues and get good advice about things you are struggling with on your own. Story 89. While I have absolute faith in the medical system's ability to resolve physical trauma, I have no faith in its ability to resolve disease. As far as I can tell, the American medical system has turned into a giant pill dispenser with the apparent goal of getting everyone medicated permanently. I do not want that. I know many people who are taking multiple medications several times per day, and I do not want that. I will go if I am injured, but beyond that, I am not interested. Story 90. My brother was tired of seeing doctors frequently due to cancer. He died of a heart attack 10 days ago at 72 years old. Rest in peace, brother. Story 91. I am here for a good time, not a long time. Dying in my 40s is preferable to 20 more years filled with stress, medication, and general American nonsense. Story 92. I'm going to start by saying I have a good life. I love my wife. She's smart, beautiful, and has a kind soul. I have two grown children who are wonderful people. Nice, kind, and smart. I have a great job with a salary over $240,000, a nice car, two houses, and I am generally healthy. Doctor visits are usually for stitches or broken bones from accidents. I don't go to the doctor unless needed because I honestly don't really care when I go. Life is hard for men. Women do not understand the pressure and stress we face. I would not burden my wife with my problems, nor would I ask or expect help from others. One day I will get sick and my life will end, and I accept that as my fate. The last thing I would want is to extend a sick life. Regarding therapy, I have accepted that you are born alone, die alone, and are responsible for enduring the path you have chosen alone. I believe only a weak person would require somebody else to talk you through your problems. It's not that I am theoretically against any of it. It's that I don't think it is generally beneficial. To live is to suffer. To survive is to find meaning in the suffering. Story 93. I thought annual checkups were just for older adults. As far as I know, people generally do not go to the doctor unless there is something wrong with them. However, it might be different for women because they have different medical needs. Story 94. Going to therapy. Many people assume traditional therapy is the only way and is guaranteed to help. It is not. This does not mean the person is not trying or has not met the right therapist. Sometimes traditional therapy is not helpful. What many men do, especially those who have not been helped by traditional therapy, is maintain their social circle and support network and engage in their hobbies. Story 95. Oversimplified and only partially true. We are terrified of being seen as weak, and it is not how you think. People say admitting weakness and seeking help is hard and therefore shows strength, but those same people will turn their backs on a man they consider weak. Men are disposable. While the act of fixing yourself is admired, the fact that you need fixing will result in being discarded for someone who does not, or at least appears not to. Story 96. Because annual checkups are not recommended for healthy men under 50, and insurance does not cover them, a checkup every 3 years is advised. Story 97. What year did you first hear that? I'm not sure if that is common nowadays. I know many men who go to therapy. Story 98. It's part of being a man. Showing weakness and vulnerability is looked down upon by other men and women. Sure, there are a rare few who are different, but for the most part, and in my experience as well, if we complain or appear weak, we're just told to man up. I've realized over the years that people just don't care about how we are doing, so I shoulder the pain and burden and keep moving. No complaining, no whining. If I ever need to cry, it is by myself with a few beers. Story 99. Some people lack motivation. Successful individuals take care of their health by visiting healthcare professionals. Others make excuses and fail to reach their potential. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.